Okay, I have checked my physician orders, and the dressing change is due for the central line. I went on the computer, checked that it needs to be changed. It hasn't been changed yet. So I gathered my supplies, a Tegaderm, a 2x2, ChloroPrep, sterile gloves, clean gloves, hand sanitizer, and some masks. And I came into my patient's room. I'm going to identify myself to the patient, tell him what I'm here to do. I identify the patient, check his armband, ask his name and date of birth. Okay. I'm going to explain to my patient what we're going to do. We're going to change your dressing, and we'll go ahead and get started. I washed my hands before I entered the room. I'm going to sanitize now. And I'm going to go ahead and just expose the area here. I'm going to put a mask on myself. I'm going to put a mask on the patient first, and I'll explain to him it's just so we can keep everything sterile when we open up the dressing here. If my patient was able to turn and keep his head turned, I would just have him do that. I will then place a mask on myself for the same reasons. And as I'm doing this, I'm going to look at the site, and I want to make sure that around the 2x2 is not red, is not just that it looks right. I'm going to palpate and ask if there's any pain there. No pain. Okay. So then I'm just going to start peeling back the dressing, and I'm going to go towards the insertion site just so I can get it started here. Okay, then I'm going to put on my clean gloves. Then I'm going to remove the dressing. Now when I remove the dressing, I'm going to look to see if there's any drainage, and if there is, I'm going to note the type, color, amount, and any odor. I'm going to look at the site to see if there's any if it's reddened at all, if there's any drainage. If there is, we're going to note that type, color, amount, and odor. And then I'm going to place this in my clean gloves and dispose of them. And then I will sanitize my hands again here. And then we'll start dressing change. I'm going to open all my supplies here in a sterile manner. Careful to only touch my 1-inch border. And then my 2x2. It stayed within the border, so it should be okay here. Okay, then I'm going to do my sterile gloves. I'm not going to turn away from my sterile site. And be sure to keep this out of the site over there. And I'll pick this up. continue to be sterile. So now I'm going to go ahead and clean the site. And with the ChlorPrep, we're going to want to use friction around the site. I'm going to contaminate my pinky. I'm going to lift up the lumens, if it was not a straw, and scrub underneath the lumen as good as I could. Okay, so now we're clean. Now my pinky's contaminated and I know this. I'm going to let it dry completely. When I looked at the insertion site, I also looked at the sutures to make sure there was no reddened area and that they looked okay and they're still intact. Now that that's dry, I'm going to go ahead and place my sterile 2x2 over the site, and I will place my tegator. Now I'm going to keep the crease here over the lumen as I lay it so I can mold it and cover